important as checking in on your body. Talking about it does not make you weak. It makes you human. So be mindful when checking in on your friends and make sure they're really okay. And don't be afraid to be honest when someone asks you well. Your mind matters always. I am Gabriella Ramsey from Saraswati Girls Hindu College, and this is your Kiddies Capsule.
Hello, my name is Vincent, and today I want to talk about the importance of making time for a laugh. Yes, a laugh. During stressful periods, the body releases a hormone called cortisol. Cortisol helps the body respond to stress, but when stress continues for long periods, cortisol levels can remain too high and negatively affect health and mood. Research shows that laughter helps activate relaxation responses in the body, which helps lower cortisol levels and improve mood. Taking time to laugh and enjoy positive moments with family and friends is not only fun, but also supports better physical and mental health. So go on out there and have fun, because a little laughter is very important and healthy for the body and mind. That was your Kiddies Capsule. Have a great night.
And we say a special thank you for those pearls of wisdom. It was a particularly insightful capsule this evening. And it's time for a short break. When we return, the Medical Minds segment awaits.
It's Super Month and Savings, only at Passat's The Food King. Incredible deals on Santa Rosa Vienna sausage, 4 tins, now $20. Golden brand margarine stick to 25 grams, 3 packs, now $20. Guiltless Yum yogurt, 4 tubs, now $20. More wow deals on Sierra chicken fracks, 3 packs, now $20. Happy Charming noodles, rolled or fine, 340 grams, 3 packs, now $20. Lucozade Energy, 360 ml, 2 bottles, now $20. Fresh Harvest Chana and Brine, 3 tins, now $20. More super savings on Moo low fat evaporated milk, 250 ml, 4 packs, now $20. Blue Sea tuna flakes in water and oil, 4 tins, now $20. Cataly tomato ketchup, 3 packs, now $20. Sale ends June 7th or while stocks last.
Quality value, that's our way. The real Passats, we're here to stay. The Food King Passats.
We are your one-stop, most convenient, most helpful, most caring community pharmacy. Our pharmaceutical services include dispensing medicines, repeat dispensing, clinical governance. But we also have a fully stocked convenience store featuring our refreshment aisle, grocery lane, personal care products, toys, pet supplies. We are most conveniently located out of the traffic, just 2 minutes off the highway in Heartland Plaza, Endeavour, Chaguanas. Contact us on 220-8705 or 470-5938 and visit us soon.
Magical Expressions Limited is the largest local importer and distributor of fresh cut stems, offering the widest range of beautiful flowers at the most affordable prices. Call us today at 701-6488 or visit our website to order.
Gaming Express Limited is a premium importer and retailer of the highest quality brand name electronics. We stock the widest range of PlayStation, Nintendo Switch, Samsung and Apple devices and accessories. Visit us at Shop 52, Level 2 Gulf City Mall in San Fernando, or contact us by phone or WhatsApp message at 687-7480 or 301-9797 or 798-1280. Like our Facebook and Instagram pages for updates on products and services.
Welcome back to the #1 show for news, views, and interviews of all things medical. Dr. Nadia Watson is a palliative and family care physician whose work really sits at the intersection of science and compassion as she guides patients and families through serious illness with clarity, courage, and grace. This evening, she discusses that silent killer of hypertension in our medical minds.
Dr. Nadia Watson with another top tip. And today, I'm stealing a line I read in an article by Dr. Joel Tilak Singh. It was an article about high blood pressure, and the first line was, "What if feeling fine meant nothing?" And what that powerful sentence means is that many of you all are walking around with diabetes and high blood pressure, but we're focusing on the high blood pressure, and you all have no idea, and all you're feeling fine. Meanwhile, your blood pressure going up, so you're having damage to your vessels, as your blood vessels, you're damaging your kidney, you're damaging your heart, and you ain't know nothing because you're not checking up on it. And it have some people that know that they have high blood pressure, but they don't take the tablets because they take the pressure yesterday and it was good, but not understanding that your blood pressure fluctuates throughout the day. So if you take it at 8 o'clock and it's good, by 10 o'clock in the night, we call that the twilight hour, like around 2 o'clock in the morning, that kind of hour, that's when all them heart attack and stroke just come to the hospital. I know because I worked there for quite a while. Because your blood pressure good and you're feeling fine, everybody's feeling fine. So that little sentence there, if all you're not too sure, if all you have high blood pressure or even diabetes, go and check on your doctor. And if you have high blood pressure but you just take your tablet only when you get a headache or only when your pressure high because you checked it last week and it was good, all this time you feeling fine, but it ain't good because everything else been affected. We will see it again. Your heart, your kidneys, your blood vessels, and the first time you'll ever know that you have high blood pressure is when you get the first stroke or the first heart attack. So don't let that be you. All right, so go and check your doctor, okay? So I'll be safe and take care.
And we say a special thank you to Dr. Watson, and you can get more of her top tips at a Healthy Living Medical Practice on Facebook. And once more we say thank you for her love, service and support. No stranger to the Ask the Doctor family. Now it's time to put your medical knowledge to the test, and our wonderful audience members are ready to take on the challenge. The giveaway segment with the compliments of Great Health Works is coming up next.
Only at Passat, the Food King. Incredible deals on Santa Rosa Chicken Vienna Sausage, 4 tins, now $20. Golden Brand Margarine Stick, 225 grams, 3-pack, now $20. Guiltless Yum Yogurt, 4 tubs, now $20. More Wowdies on Sierra Chicken Franks, 3 packs, $20. Lucozade Energy Drink, 360 ml, 2 bottles, now $20. Fresh Harvest Chana and Brine, 3 tins, now $20. More super savings on Moo low-fat evaporated milk, 250 ml, 4 packs, now $20. Blue Sea Tuna Flakes and Oil, 4 tins, now $20. Cataly Tomato Ketchup, 3 packs, now $20. Sale ends June 7th or while stocks last.
Besides, quality value, that's our way. A real Besides, we're here to stay. The Food King Besides.
In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
It's Super Month and Savings, only at Passat's The Food King. Incredible deals on Santa Rosa Vienna Sausage, 4 tins, now $20. Golden Brand Margarine Stick, 225 grams, 3 packs, now $20. Guiltless Yum Yogurt, 4 tubs, now $20. More wow deals on Sierra Chicken Franks, 3 packs, now $20. Happy Charming Noodles, rolled or fine, 340 grams, 3 packs, now $20. Lucozade Energy, 360 ml, 2 bottles, now $20. Fresh Harvest Chana and Brine, 3 tins, now $20. More super savings on Moo low-fat evaporated milk, 250 ml, 4 packs, now $20. Blue Sea Tuna Flakes in water and oil, 4 tins, tins, now $20. Cataly tomato ketchup, 3 packs, now $20. Sale ends June 7th or while stocks last.
Quality value, that's our way. The real Versace, we're here to stay. The Food King Versace.
Welcome back to CNC3's Ask the Doctor. As a reminder, we're live on Thursdays with a rerun on Friday at 11 a.m. or Saturday at 11:30 a.m. So it's giveaway time. A special hello to Joseph Sandel and the rest of his brilliant team at Great Health Works. So the number's on the screen, and as a reminder, when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. Our friend Uncle Rajiv Surat Singh is waiting to hear from you. And of course, feel free to send in even videos of school-age children for the Kiddies Capsule. He's in charge as well too in the giveaways and the call-in segments. So, our question this evening has an ears, nose and throat flavor. What surgery that's often called a nose job, in inverted commas, can also treat conditions like a deviated septum, perhaps due to trauma or born with changes to that septum? I'll give you a hint. It starts with an R. What surgery, often called a nose job? Hello. Welcome to Ask the Doctor. You're on the air. Hello. Welcome to Ask the Doctor. It's the giveaway segment. Do you have an answer? It sounds like we lost that call. So as a reminder, listen on your telephone, not the TV set. I know you don't want to miss a second of your show. So tell me, starting with the letter R, what's the medical term for that procedure? Good evening. Hello? Welcome to Ask the Doctor. You're on the air.
Who's talking to me?
Welcome to Ask the Doctor.
Hello?
We're hearing you loud and clear. Good evening,
I'm
ma'am.
not hearing you, but is the answer rhinoplasty?
That is indeed the correct answer, and I hope that you're hearing us now. Congratulations.
I can't
You're a
hear
winner.
you.
Rhinoplasty is indeed a medical term. Congratulations, and stay on the line because we want to take some of your personal information off the air. Wow. So, well done. Rhinoplasty, not just used in cosmesis, but also in the surgical treatment for problems such as a deviated nose bridge or nasal septum. Now it's time for a short break, and when we return, there'll be more of your questions and hopefully answers as the open forum comes up.
Sherwin Gardner live in Sold Out on Sunday 7th June at Napa Porta, Spain. Tickets $250. Get yours now. Available at Crosby St. James, all extra food supermarkets, Simon's Music Supplies, Board Street, all Kenny's Sports Stores, Dominican Bookstore, St. Finbar's Compound, Napa Box Office, online at islandetickets.com. For more info, call 358-6397. Sherwin Gardner, Sold Out.
It's Super Month in Savings. Only at Passage, the Food King. Incredible deals on Santa Rosa Chicken Vienna Sausage, 4 tins, now $20. Golden Brand Margarine Stick, 225 grams, 3 packs, now $20. Guiltless Yum Yogurt, 4 tubs, now $20. More wow deals on Sierra Chicken Franks, 3 packs, $20. Lucozade Energy Drink, 360 ml, 2 bottles, now $20. Fresh Harvest, China and Brine. 3 tins, now $20. More super savings on Moo, low-fat evaporated milk, 250 ml. 4 packs, now $20. Blue Sea tuna flakes and oil, 4 tins, now $20. Cataly tomato ketchup, 3 packs, now $20. Sale ends June 7th or while stocks last.
Bushside, quality value, that's our way. A real Bushsides, we're here to stay. The Food King Bushsides.
Welcome to Holiday Inn Express and Suites.
Do enjoy, Stacey. You want some coffee?
Can I have a
Perfect then.
That's exactly what we need.
Hi, the pool is this way.
Whatever you're here for, we're here for you. Stay smart at the Holiday Inn Express and Suites.
You shop it, you stock it, now it's time to own it. Introducing the West Indian Traders Limited Initial Public Offering, your opportunity to become a shareholder in the company, delivering the brands you know and love. With 30 years of success, WIT is opening its doors for every consumer to invest in its growing future. Offer closes June 5th, 2026, and your minimum investment is only $100. Visit goipo.jncb.com to review the prospectus and apply today. The lead broker and arranger is NCB Merchant Bank Trinidad and Tobago Limited. Conditions apply.
Some of us like to test limits, but there won't always be second chances. Obey the speed limits. Maybe you don't value your life, but others value theirs. A message from the TTPS.
Welcome back to CNC3's Ask the Doctor. It's time for the open forum with questions of a medical nature. We'd love to hear from you. And as a reminder, listen on your telephone rather than the TV set, because that delay creates confusion. As we head to South Trinidad, San Fernando is on the line. Thank you for waiting and good evening. Oops, sounds like we lost that call. Hello. Right, so, but the numbers on the screen, the phone line's already burning up, and we would love to hear from you. So this is your opportunity to call in. We know that we were speaking about hypertension, and indeed it was alluded to in the medical minds about the fact that these numbers often rise. It could be a very insidious problem, but with devastating complications. The eyes, the brain, the heart, kidneys, and blood vessels. And we're trying to get your blood pressure under 130/80 millimeters of mercury for most of the world. Of course, the gold standard may be less than 120/80 millimeters of mercury. And that is in, of course, conjunction with your doctor or pharmacist, your diet, exercise, weight loss, and medications if warranted. And of course, we're doing blood investigations to monitor not just your blood pressure, but also issues like sugar, cholesterol, and so many of those chronic, non-communicable diseases. As we stay in the Southland, as Princestown is next up. Good evening. Welcome to our show. Hello.
Good evening, Doctor.
Thank you for joining us, sir. You're opening the batting on the open forum. Welcome.
Yes, Doctor. I appreciate some of the comments in your first salvo.
Yes, sir.
Yes, Doctor. I said I listened to your opening salvo, and I made note of some of the chronic disease. My question is sort of a stupid question, really. Sometimes you go to the drugstore with a prescription for a prescribed drug. Most times they tell you they don't have the original drug, but they have the generic drug. I want to know what are the advantages and disadvantages of the original drug, the genuine drug, and the and the generic drug
options.
And
yes.
sometimes they even recommend a herbal treatment for you. So, Doc, I will listen off the air to your explanation on that.
And thank you so much for taking the time to call in, because it's a very insightful question and relevant in today's world because of the astronomical and burgeoning costs associated with healthcare. And when we're speaking about a particular agent or medication, you're looking at safety, tolerability, the efficacy of that agent, and of course at an appropriate cost. And it is very difficult for most healthcare systems in the world to manage only original drugs as part of the formulary. That is why the CDAP, or even within the hospital and health centers, you may find, because of the large number of tablets which would be required for, let's say, diabetes, and the quintessential drug in type 2 diabetes is metformin, and the government may perhaps have to buy millions of tablets of metformin during a specific period of time. So it must be done at an appropriate cost, of course, ensuring that the safety must be paramount, the tolerability by patients, and it must be effective. You don't want to be on a drug that will not work. Now, it has been said that some generics would be better than others. There are some parts of India, Germany, or Canada. Many of those drugs have formed a part of the shelves in this country. Sometimes the molecules are less stable, or the way that they are assimilated in the body may vary. But have a chat with your doctor or pharmacist about the excellent generic options which are available. I'm a fan of such. So although sometimes you may find that patients would prefer to use a drug which would be prescribed as the original title, but as a result of cost, or even if we think that it comes from an excellent company, the use of those medications are very much on the cards, particularly in today's world of medicine. So the way that these drugs are stored, of course, are important. You want to ensure that they're not exposed to direct heat, the molecular structure, where they are made, but ensuring that you are looking at your goals. So you're looking at perhaps an A1C if you're a person with diabetes using a generic drug. You're looking at your blood pressure to ensure that you are getting to targets, cholesterol levels. So this is an opportunity to bring perhaps the health economic idea into the front burner, because it is a very real part of modern medicine. And thank you, it's a superb question. Have a chat with your healthcare provider about which ones would be appropriate for you. And don't be embarrassed to switch, because many of these will have similar or identical outcomes to the original option. In terms of herbal treatments, be wary that because a drug is herbal, it does not necessarily equate to being safe. Sometimes there may be adverse effects, and perhaps these drugs have not undergone rigorous clinical trials to ensure that they will be effective. And there may be interactions with drugs prescribed by a physician. So that too could be part of the clinical encounter when you see your healthcare professional. Our next caller hails from Arima. Good evening and welcome to Ask the Doctor.
Good evening, Doctor. I just wanted to say that I'm waiting for this part of your program, and I would like to suggest to the government that in terms of the eye care,
yes,
we have 5 hospitals in Trinidad and Tobago, and people can be home. So that the amount of patients that have to go to cataract, and even there are many people that go to the eye clinic every day, which is like 150 to 200 persons a day, especially tired out the staff, right?
Yes.
It's about time we zone the eye clinic so that what is taking place at the hospital,
yes,
with the foreigners, wouldn't be happening. They would not have had to import these doctors into Trinidad and Tobago because they are qualified people, right? So I think somebody from the ministry is listening.
Very insightful observation. Thank you. Yes, very insightful statement that we need to deal with the burden associated with perhaps the commonest surgical procedure in the world. How are we going to whittle down some of the waiting lists associated with persons due for cataract surgery? Thank you very much for being part of our program. And I want to emphasize that we need an audit from the Ministry of Health, not just to look at reasons and how it can be improved within the various regional health authorities, but also to ensure the waiting times are whittled down or shortened, and also to ensure that when these projects occur, appropriate follow-up is maintained, because these individuals who have had surgery done will need to now join these already overburdened clinics. So if they're not already part of the program, they need to get eye drops, they need to be followed up, perhaps there may be the odd complications such as infections. So this could also lead to rising health costs and also worsen the already long waiting times within the public sector. Arima is on the line again. Good evening. Welcome to our show.
Good evening, Doc.
Thank you for being part of our program.
Thank you. You're welcome. Okay, my question is,
yes, ma'am.
Can you explain in simple terms why Soapy, the girl by sulfate will be prescribed to someone? I don't know if I pronounce the word correctly.
But the last part of your question was muffled. Can you repeat it for me?
Bisulfate.
Clopidogrel bisulfate. Clopidogrel, absolutely. Yes, ma'am.
Bisulfate.
Yes.
Why? If you could explain in simple terms, why it will be prescribed to someone.
Thank you very much for that excellent question, and it would be a pleasure and honor to do so. So, clopidogrel has become actually a part of CDAP recently. So, it is an antiplatelet drug. So we know that platelets are found in the bloodstream involved with blood clotting, and the classic anti-inflammatory, antiplatelet drug would be aspirin. As we know, in patients who have had heart disease or strokes, if they've had blockages to the arteries, in order to thin the blood, to use a vernacular term. And clopidogrel, which is the generic name to another drug, acts in a different pathway to ensure that your blood is thin, in inverted commas, so it is another blood thinner. So we know about aspirin, and it may be used in conjunction with this to ensure persons who are admitted to hospital with chest pain, shortness of breath, if you've had a heart attack, or if there are blockages, that term is angina, and it may be associated with nausea, vomiting, sweating, shortness of breath. Some people, of course, may have side effects, because if you're on aspirin and clopidogrel, there is an increased risk for bleeding. So doctors may sometimes prescribe a drug to reduce the production of stomach acid to prevent bleeding. There may be interactions with some of these drugs that lower the efficacy of clopidogrel. And sometimes another antiplatelet drug is used instead. So the indication for this drug is with respect to blockages in the arteries, whether you have angina, if you've had a history of a heart attack, and subsequently further testing entailed a wire or a tube called a stent to open the arteries. It would be mandatory that you use two of those drugs, such as aspirin and clopidogrel, for a period of time for perhaps 6 to 12 months. And if you have had a stroke for a certain period of time, 21 days after a blockage in the artery to the brain, the doctors would recommend using both aspirin and clopidogrel. The downside would be the increased risk for bleeding, but it's a commonly used agent, and perhaps 1 year or more after a heart attack, admission to hospital, you should be on both medications, unless, of course, there is bleeding or a reason for you not to do so. The phone lines are burning up. Good evening and welcome to the open forum of Ask the Doctor. You're on the air.
Hello.
Hello.
Oh, yes, this is Arena calling back.
Yes, ma'am.
I'm not sure if there's a department in this Ministry of Health that does research regarding herbs. Because herbs are made for healing.
But regarding herbal treatments?
Yes, herbal treatments. And it do work.
Yes.
You just need to,
absolutely.
do the research.
Properly analyzed and used. Yes. Thank you very much. Thank you very much. And indeed, the Food and Drug Administration, especially when these drugs are marketed prior to use on the pharmacy shelves or the use within a healthcare or hospital setting, they would have to be approved for use at the Food and Drug and at the level of the Ministry of Health, and usually would undergo rigorous testing. Of course, and I always emphasize, there is a downside that natural drugs do not imply safety for all, and there may be interactions with some of the medications which would be prescribed by a doctor. The evidence is rising. A simple drug such as aspirin, would you believe, was derived from the bark of the willow tree. So many of the medications in mainstream medicine have actually had origins in terms of herbal or plant material. So, but safety, tolerability, efficacy, and an appropriate price, or STEP is a good acronym when we're talking about drugs. Good point again. Our next caller hails from Oropun. Good evening and welcome to our show.
Hi, Dr. Knight.
Thank you for being part of our family this evening.
Right, I want to ask a question. What happened? Sometimes my scratches me, right? And when it scratches, it brings something up, some little hives. In a long time, it's like it's mad blood. So it comes up on my skin and then it goes back down. But it's in course.
Thank you very much. And that's a very common clinical conundrum, because I think the person who will have problems with the skin often finds himself or herself a medical orphan. You're going by a family doctor, a dermatologist or skin specialist, sometimes someone who deals with allergies, and you're trying to find a reason for this so-called hives in which there may be red, raised lesions throughout the skin that tend to come and go. Of course, the simple assumption is that it may be due to perhaps something in the environment that one may be allergic to, but it's important to do some basic blood investigations, such as your complete blood count. Persons who have a low blood count may find that there may be rashes of this type, the so-called mad blood, as you mentioned on your call. Sometimes a kidney function, liver, thyroid function test may form a part of your initial investigations. There may be immune-mediated problems. If you have antibodies which are attacking your skin, your doctor particularly may be interested in some of the classic problems such as lupus. There are allergy testing that would be performed in various labs. Are you allergic to pollen, pets, certain foods such as cow's milk protein, nuts, shellfish, some of the basic commonly used food and drink that may create reactions. And don't underestimate the role for stress. The mind, body, and skin are so closely linked when we think about it that emotional stress will also increase the chance for having these problems affecting the skin. So it's easy to use steroids or antihistamines, but perhaps it's difficult, devilishly so, to find the underlying cause. Basic blood tests, have a chat with your family doctor if a dermatologist or an allergy specialist is required, and then some basic panels may be part of your initial therapeutic management. What a great question, because it's so common and it's tricky to treat. As we head to Central Trinidad, as Warrenville is on the line, good evening and welcome to our show.
Good evening.
Thank you for joining us, ma'am. Welcome.
Doc, I have a cold. I get a virus recently.
I'm sorry to hear
and it
that.
leaves me with a cold.
Yes.
But no matter what I take, it's not helping me. I went by the doctor and they're not doing nothing not going on.
Yes, ma'am.
To stop it. But my son got me pregnant this evening and tell me that I could contract pneumonia.
Mm-hmm. Thank you very much for taking the time to call in. And one of the disclaimers on the show, of course, I'm not attempting to diagnose, but just to guide you in the right direction. Because if you're having persistent symptoms after a virus, there is the possibility that it may have evolved into a secondary problem. So your son is right that there is a chance of something bacterial. Although we may start with a virus, you don't need antibiotics for a fever, a runny nose, some sniffles, just some fluids, rest, tender loving care, and paracetamol may do the trick. But if you're having a cough with very mucky sputum, you're bringing up blood. If you're having fever, chills, trembling, persistent for perhaps more than a week from the onset of symptoms, have a chat with your doctor. If there is what we call a secondary bacterial infection, your doctors may want to consider then the use of antibiotics, a chest x-ray if these are particularly worrying, and even a blood test to look at your white cell count and some inflammatory markers to determine if there are internal issues that linger. And I'll tell you that during COVID-19, persons found that a low dose of steroids was found to be very useful as an anti-inflammatory for those who had a lingering cough after the initial onslaught of the virus. So the fever, sore throat might have improved, but that persistent cough for perhaps weeks following it got better with steroids, and particularly those individuals who had to be hospitalized if you were on oxygen, admitted to intensive care. The use of steroids during the COVID-19 pandemic actually saved lives, and it was found to do so globally, inclusive of Trinidad and Tobago. What a program this evening. And as we say, parting is always such sweet sorrow. We'd like to close with a quote from Seneca. We are more often frightened than hurt, and we suffer more from imagination than in reality. Isn't that so true about life? We are more often frightened than hurt, and suffer more from imagination. I think he understood something that modern medicine sees every day. Fear itself can become a form of suffering. Many people spend enormous emotional energy worrying about illnesses that may never develop, symptoms that turn out to be harmless, or worst-case scenarios that exist mainly in the mind. This does not mean that fears are foolish. Fear is deeply human. Fear protects us. But unchecked fear, when you think about it, cortisol and adrenaline that starts surging, can quietly damage your mental and physical health. They raise those stress hormones, worsening sleep. They elevate your blood pressure, and they steal your peace long before any disease appears. Thank you for trusting me to walk beside you each week, in your homes and in your hearts. To my team behind the lens, to the selfless Neela and baby Daniel, and to you, our viewers, stay strong, stay curious, and never stop choosing kindness. A very special birthday greeting goes out to someone who brings calm to chaos, kindness to medicine, and warmth to every room she enters. Neela, thank you for your compassion, your wisdom, and your grace. Blessings on May the 25th. And to all of us, rest, reflect, love deeply. God bless you. We'll see you next time on Ask the Doctor.
Ask the Doctor is brought to you in part by Alive, by Nature's Way, distributed by H&J Enterprises, and XL Health TT, the official supplements of the CPL.